Verapamil Comprehensive Drug Profile. Shot 1. Basic drug information. Generic name, Verapamil. Drug class, calcium channel blocker, non-dihydropyridine class. Specifically a phenylalkylamine derivative. Available dosage forms, oral tablets, immediate release, 40 milligrams, 80 milligrams, 120 milligrams, oral tablets, 120 milligrams, 180 milligrams, 240 milligrams, oral capsules, extended release, 100 milligrams, 120 milligrams, 280 milligrams, 300 milligrams, 300 milligrams, 360 milligrams. Intravenous IV injection, 2.5 milligram milliliter. Brand names, Callan, Callan SR, Veralin PM, Isoptin, Isoptin SR. Cover HS. Definition: Verapamil is a prescription medication used to manage cardiovascular conditions such as high blood pressure, angina, and certain arrhythmias. It works primarily by relaxing blood vessels and decreasing the workload on the heart, thereby reducing blood pressure and controlling heart rhythm. 3. Mechanism of action, MOA. Verapamil inhibits L-type calcium channels in cardiac and vascular smooth muscle cells. In the heart, slows depolarization in the sinoatrial SA and atrioventricular AV nodes, decreases heart rate, reduces myocardial contractility, negative inotropic effect. In blood vessels, causes vasodilation by relaxing smooth muscle, decreases systemic vascular resistance and blood pressure. Resulting effects: reduces oxygen demand of the heart, controls abnormal heart rhythms, alleviates anginal symptoms. 4. Indications, approved uses. Hypertension, HTN, to lower blood pressure and reduce the risk of stroke or heart attack. Angina pectoris, chronic stable and vasospastic, Prinzmetal's angina. Supraventricular tachycardia, SVT, paroxysmal supraventricular tachycardia, including AV nodal reentrant tachycardia. Atrial fibrillation flutter, rate control by slowing AV conduction. Off-label uses, cluster headaches, hypertrophic cardiomyopathy, migraine prophylaxis, Raynaud's phenomenon. Mono 5. Contraindications. Do not use verapamil in the following conditions: severe hypotension, SBP 90 mm/Hg, advanced heart block, 2nd or 3rd degree without a pacemaker, sick sinus syndrome without a pacemaker, cardiogenic shock, severe left ventricular dysfunction or decompensated heart failure, Wolff-Parkinson-White, WPW, syndrome with atrial fibrillation, may worsen arrhythmias, hypersensitivity to verapamil or its components. 6. Precautions before taking verapamil. Inform your doctor if you have history of heart failure, AV block or bradycardia, liver dysfunction, verapamil is metabolized hepatically, kidney disease may affect elimination, neuromuscular diseases, e.g. myasthenia gravis, Duchenne muscular dystrophy. Pregnancy, Category C, use only if benefits outweigh risks. Breastfeeding, verapamil is excreted in breast milk. Caution is advised. Avoid. It inhibits CYP3A4 and increases verapamil levels. 7. How to use administration instructions. Oral tablets, capsules. Take with food or milk to reduce GI upset. Extended release, ER tablets, capsules. Swallow whole. Do not crush or chew. Take at consistent times daily. Drink a full glass of water unless otherwise instructed. Administered slowly over 2 to 3 minutes by a healthcare provider in hospital settings. 8. Dosing information, adults. Condition, form, usual adult dose. Hypertension, ER tablet, 1 and 8 to 240 milligrams once daily, max 480 milligrams per day. Angina, immediate release tablet, 80 to 120 milligrams 3 to 4 times a day. SVED IV injection, 5 to 10 milligrams over 2 minutes, may repeat after 30 minutes. Atrial fibrillation, rate control. ER capsule, 240 to 360 milligrams per day in divided doses. Off-label for cluster headache, ER capsule, 240 to 960 milligrams per day, under specialist supervision. Dose should be individualized based on age, renal hepatic function, and clinical response. 9. Missed dose, overdose. Missed dose. Take as soon as you remember unless it's close to the next dose. Do not double dose. Overdose symptoms: severe hypotension, bradycardia, AV block, heart failure, possible cardiac arrest. Management of overdose: activated charcoal if recent ingestion, IV fluids, vasopressors, e.g. norepinephrine, I4 calcium gluconate to counteract effects, temporary cardiac pacing if AV block occurs. Inotropes, e.g. dopamine in severe myocardial depression. Not 10. When to stop or avoid taking verapamil. If experiencing severe hypotension or bradycardia, new or worsening heart failure symptoms, allergic reaction, rash, facial swelling, difficulty breathing, stop only under medical advice. Avoid abrupt discontinuation, especially in angina, can trigger rebound symptoms. 11. Side effects detailed. Very common, 10%. Constipation, most common, up to 25% of users. Common, 1 to 10%. Dizziness, nausea, headache, fatigue, edema, especially of ankles, feet, bradycardia, hypotension. Uncommon, rare. AV block, syncope, skin rash or urticaria, gingival hyperplasia, gum overgrowth, hepatotoxicity, elevated liver enzymes, hepatitis, gynecomastia in long-term use. Severe reactions, very rare. Stevens-Johnson syndrome, anaphylaxis, severe heart failure, severe bradycardia leading to asystole, rare but life-threatening. #12. Vital information, key points to remember. Monitor blood pressure and heart rate regularly. Avoid grapefruit juice. Can cause dangerously high drug levels. Do not crush chew extended-release tablets or capsules. Take medication at the same time every day. Do not stop suddenly. Taper off under guidance. Use caution with driving or operating machinery. Can cause drowsiness or dizziness. Report signs of heart failure, swelling, fatigue, breathing difficulty, promptly. 13. Drug interactions. Verapamil increases the levels of digoxin, risk of toxicity, carbamazepine, CNS toxicity, theophylline, increased toxicity risk, cyclosporin, nephrotoxicity, simvastatin, lovastatin, myopathy, rhabdomyolysis risk. Drugs that increase verapamil levels, CYP3A4 inhibitors, erythromycin, ketoconazole ritonavir grapefruit juice. Drugs that decrease verapamil levels, CYP3A4 inducers, rifampin, phenytoin, phenobarbital, St. John's wort. Caution with beta blockers, e.g. metoprolol, atenolol, risk of bradycardia, AV block, heart failure. Amiodarone, risk of conduction disturbances, diuretics or antihypertensives, additive hypotensive effect. Alcohol increases verapamil effect. Thank you. Have a nice day.